Hello and welcome to the Imperial College London Global Masters of Public Health Admissions webinar. I'm really glad that you've been able to join us today. A few housekeeping things before we get going. You'll notice that at the bottom of your screen here, you'll have a Q&A function. That's where you'll be able to ask questions to us. We do try and get through those questions as quick as we can. Our team's going to be answering on the backside, but we may not be able to get through all of your questions just at once. So please do bear with us as we do that. Please refrain from using the chat function. That helps us to just get through the program and make sure that we can answer your questions and can triage those. So moving on to the agenda today. So our agenda is we're going to do a welcome. I'm going to give you an overview of the Masters in Public Health program and an overview of the student experience and delivery, as well as the tutoring system. I'm going to then hand it over to my colleague Anna, who is the online coordinator here at Imperial, and she is going to talk about the admissions process, which is the most important point at this part at this stage. And then I'm going to hand it over to my colleague, Dr. Natasha Krum, who's going to talk about the research portfolio, which is a big component of our master's program, although you may not choose to join our master's program, and we'll talk about that as we move along. And then finally, we'll have some opportunity for question and answers, about 15 minutes with the team. As I mentioned, the team is going to be trying to answer your questions as we move along. Do look in the question and answer box to see if your question has also been asked by someone else and our team has responded to that. All right, so what is the Master of Public Health at Imperial College? So we have three opportunities for you to join us. The first is the PG certification, which is a one-year program, and I'll show you the course structure. That builds onto the PG diploma, which if you want to continue to study with us, build more knowledge and more information around public health. And then we've got a master's track, which is a 2- and 3-year program. And I'll show you all of those different courses. But sort of to give you a background on the philosophy, what we want to do is to give you a fully online part-time program that teaches you all of the core components of what you need to do to be a public health professional. We have folks who join us from public health already and they want to get that certification. And we've got folks who are trying to change their careers, and we really welcome admissions from any of those folks as they go along. Our course is really broad and in its understanding, and the idea is that we want to build both your theory and practice as you go along, and we do that through the assessments as well as the courses that you see and all of the content on the course. As you'll already know, Coursera is a platform that we use to build our courses, and what you'll find is that in each term, if you're on the 2-year master's course, you will have 3 specializations or modules, as we call them here in the UK, and they will take you through your course of study. You can see here that you've got core courses which are in green, and those are the things that we feel like are really fundamental to our experience as public health professionals. So you learn about global diseases and think about all of the different types and categories of diseases the WHO has outlined and how you might address those. You think about epidemiology for public health, statistics for public health, foundations of public health practice, which is really a theory-based course, health systems development, and all sorts of other courses. You also have an opportunity to take a number of different electives. The goal here is not to force you to be a quantitative person if you're not, but to give you an opportunity in these electives to really choose your own track. So we've got lots of courses that talk about essentially new and upcoming innovative ideas in public health policy, as well as I mentioned, some quantitative courses as well. So it's up to you to choose those and as you move forward. The last component is our research portfolio, and again, that's for our master's students in and of themselves. And in that, you'll be guided through the entire research process. So you'll start with learning your research question and developing that through to designing a study and thinking about methods, and then core skills. We feel like this is a really added benefit of our program as well, because not often do you think about what do you do when you're writing a grant? How does that work? How do you think about ethics? How do you apply for those? And we really cover those concepts because we know that that's what you're going to do when you leave Imperial and apply for proposals, whether it be for research or funding in either case. And then finally, you go ahead and you write your dissertation, which is a journal style article. Again, really focusing on making this a practical program for you all. In all of these modules, as I mentioned, you'll have assessments that are due at a specific point in time, but really where you can work through at your own pace the rest of the course content. As I said, assessments that really help you to apply your skills. So doing things like writing a policy brief, doing a vlog, thinking about a lay summary, all of these wonderful things. So this is the 2 years master's, as I said. So this means that you apply directly into this program and you take 2 years for your course of study. We typically state that this is about 7 hours of learning per course a week, which roughly estimates to about 20 to 30 hours, depending on how quick you are at learning or how much background you might have in these areas. So the other option that the other set of options that we provide is to do the same course of study over 3 years. And you'll see if you look at from year 1 here to year 3, these are the exact same courses offered in the same intervals as you would get if you studied on a 2-year program. But instead here, you've got 2 courses at a time. And that we find can be helpful for some folks that maybe have other commitments or just want to take a little bit of a longer time to study. Again, the quality is the same. You're in the same physical classroom, albeit on an online space, and learning at the same level. So there's no difference there at all. Where there is another opportunity, in case you are interested in not studying to the full master's, where you do include these additional courses, in particular focusing on the research component, is to do either a PG certification or a PG diploma. And these are in their own right, really standardized kind of measures of learning here in the UK and would be recognized across the globe, where you would gain those core skills to say after 1 year, you know what, actually I'm quite well certified to start a career in public health, or after 2 years. Now, this is really up to your own decision making, and sometimes we find that this is for folks who maybe aren't quite sure if public health is what they want to do, but they want to get a certification, see how things go, or folks that feel like maybe they don't need a full master's degree, perhaps because they already have quite a lot of experience in public health, or for other reasons. It's going to be very personal for you, but we really want you to think about the different options that we have as you apply. And we'll talk about this a little bit more, but they each have their own portals to apply into the program. This is, again, just another viewing of the PG certification and diploma tracks, cutting off that 3-year master. So you can see here, if you want to go back and look at this, this is the standalone model. So you have your courses, you study them, you build community with your peers, which is really wonderful. We've got a lot of different ways that you can do this, and we found that actually our students are really well connected despite the fact that they're all across the globe. We have folks in almost every time zone currently, with a cohort, first cohort of 70 students and a second cohort of roughly 150. So we'll be joining a really wonderful group of students that are, speaking to one another regularly online and working with one another in group assessments and other means. The other things that we do offer to make sure that you all are supported beyond what your academic team provides in that course itself is the tutoring system, which essentially matches you in a group with other peers with one tutor who helps work through pastoral care issues, which really is about study skills, getting back into academic learning. We know that some of you have been out of learning for a while, or this is your first master's. You might have questions about kind of how to proceed. Maybe you've got some struggles with academic writing, and that happens to a number of our students, and that's absolutely fine. This tutor system is really there to be your support, and there's to be sort of the first connection that you get as you come in a small group with the other students. In that capacity, you'll be able to meet with your tutor one-on-one, and you'll be able to meet with a tutor group as well. So we really hope that this builds community. The other thing that we provide from a program level is what we call a program support team. And this is a group of folks, myself, Patson, and Anna included, who answer all of your queries, who make sure, if you've got any needs along the way, that we can support those, as well as helping you connect with the broader Imperial system around fees, or, I don't know, maybe disability services or anything that you need. So essentially, be rest assured that in the background, you've got a lot of people working to help you succeed. And that's our primary goal. If you apply to our program, are admitted, and then want to join us. So with that, I'm now going to hand over to my colleague, Anna, who's going to walk you through the admission system.
Hi, you can come to us through various routes. You can check the program on Imperial website and apply from Imperial website. You can also come from the MOOC, the Open Specialization content on Coursera, or from Coursera degree website. Either way, you have to make an application and submit all the necessary documentation as well as references. Once our reviewers team reviews your application and we have got all the documents that are necessary, we make you an offer. If you meet the offer conditions straight away, we accept you. If you need any conditions to be met, then, for example, English language condition, then once you meet the condition, we can accept you onto the program. Once you are accepted, you will take part in a 3 to 4 week onboarding course where you learn everything that you need prior to starting the program, which will tell you more about not only Imperial College regulations and policies, but also how to get the most out of our program. So what are we looking for? The first thing is a clear account of your interests and what your career's goals are, as well as the evidence that you have necessary professional research and other experience and skills that will be useful in pursuing our degree. It would be great also if you could include any ideas on research proposal that you may have and what future goals you may have. And finally, which is the most important as well, why are you applying? Why this program? Why Imperial College? So apart from the documentation, you need to submit a personal statement. And in the personal statement, you need to include the following things. So your previous academic and professional experience, which also includes any research experience, either quantitative or qualitative you may have, your areas of interest in healthcare, and why you're interested in public health, relevant experience in public health, either through work or research, why you want to be a professional in public health, and obviously, as I mentioned before, why you want to study with us. And there is a question that Kat could answer. Is there any particular length of the personal statement that we're looking for?
Yeah, that's a really great question, Anna. And as you're saying, this is really the opportunity for you to tell us who you are and why you want to study with us. We want to know about you. This is the touch point that we have to really understand. So what we say is typically we're looking for about a page. There's no limits and there's no kind of minimum or maximum requirement. But what we would say is shoot for about a page. Think about it as a cover letter if those of you that have applied for jobs before, or the same as a personal statement for those of you that have applied to university where this was required. So we'd say about a page. But if you need to go over or under, that's absolutely fine. Just tell us about you and try and answer these questions as best you can.
Okay, another requirements that we look for in candidates from non-English speaking countries is the English language test, and we require the higher Imperial level, and you can find more information of what tests are accepted and what it means in these tests to actually which of these tests meet the higher standards. We also have, so if you slightly below and you want to improve your English, we offer online pre-sessional English program, which is run over summer. It's a 6-week program that will help you to fulfill our entry requirements. We also have 3-week program. If you already met the English requirement, but you still want to improve, especially with regards to academic English, we recommend this short program. Finally, the COVID situation. So we are aware that it's been a difficult time, especially for public health professionals to work in the current situation. So if you need any additional information on support that Imperial College offers, then you can follow the link Imperial College Study COVID-19 to find out more.
Great, thanks, Anna. That's really helpful. And just to add in here, we know in particular that COVID-19 has been very difficult for folks to actually get that English language test. So if you're in a position where you do need an English language test, please go to our website. Do look at what we have and do read the COVID guidance, because we have tried to make it more open, make it easier for folks to be able to take that test so that it isn't a huge barrier to you coming and joining the program if you are accepted. So with that, I'm going to hand it over to Natasha, who's going to talk to you about the research portfolio.
Hi, everyone. I'm Natasha. I'm one of the teaching fellows on the GMPH, and I'm just going to give you a brief introduction or overview to the research portfolio. This is related to the independent research project that every student needs to undertake as part of the Masters, and it accounts for equivalent of 1/3 of your Masters. And as you could see, I was part of a small teaching team that covers the entire research portfolio. As Kat mentioned earlier, the research portfolio is actually made up of 4 specializations, which you will take over 4 consecutive terms. And just to highlight now, we don't expect any prior knowledge or experience in research. We really do start from the basics and build up, so to provide you with this foundation before you actually undertake your own research project. And I'm just going to give a brief overview of the 4 different specializations so you can be aware of what to expect for each one. So starting with Research Portfolio 1, the research question. Kat, could you possibly change the slide? Thank you. So starting with the Research Portfolio 1, the research question. This actually starts in the 3rd term of your first year, the summer term. So this actually allows you to have 2 terms on the GMPH, really to kind of settle into the GMPH and to start think about any topics you might be interested in. You may already have some ideas of topics, but actually previous students have found it to be really beneficial to kind of think about what they're learning during those first 2 terms and highlight areas they're sort of passionate about. So really, one of the main parts of the research question, this specialization, is to give you time and space to really develop your research question. And this is an iterative process with the literature. So you really go back and forth, looking at the literature, finding gaps in the literature, going back to kind of finding a research question, developing your research question, honing it to fit that gap. And we really do give you the time and space to do that. The other major part of this specialization is thinking about the background literature related to your research question. So we, along with our colleagues at the library, teach you how to search the literature systematically. So to identify what databases are you going to search, how to develop your search strategy. For example, what key terms will you use? What subject headings are you going to run? We'll also tell you the difference between a literature review and a systematic review. So we'll give you an overview of the key steps involved in a systematic review. And a systematic review is a methodology that some of you may undertake for your research project. So some students may do a systematic review, whereas all students will conduct a literature review. So by the end of Research Portfolio 1, you will have developed your research question and you will have your background literature. So this moves us nicely on to Research Portfolio 2, the study design. And as Kat mentioned earlier, this is really focused on methodology. So we really think about quantitative, qualitative, and mixed methods. So in terms of quantitative, we think about the different study designs, for example, randomized control trials, case controls, case series, case reports. We think about the different sampling methods you may utilize. We tell you how to calculate sample size. And we found that several students, or quite a few students, have some experience or knowledge, prior knowledge of quantitative research, but actually a vast majority don't have any prior experience of qualitative research. So we really do take a good few weeks to kind of focus on qualitative research. How does it differ to quantitative? How would you phrase a research question differently between quant and qual? We think about the theoretical underpinnings to qualitative research, the different types of data collection methods, the different type of sampling methods, the different type of data analysis methods. And there's even a chance for you to undertake a formative task to gain some experience with qualitative. So you have a chance to kind of develop your own interview guide, interview one of your peers, and actually do initial data analysis on that. And then finally, within the specialization, we think about mixed methods. So what does mixed methods mean? What are the different types of mixed methods research are there? So by the end of Research Portfolio 2, you will have developed your research protocol. So you will have developed your proposed methodology for your research question. So this moves us nicely on to Research Portfolio 3. And this is actually kind of separated into kind of 3 smaller courses, each related to a core research skill. So first course focuses on research ethics. So what is research ethics? Why is it important? What's involved in an ethics application? And we don't just think generally, we also think more specifically in terms of imperial ethics. So by the end of this section of the course, you'll have identified whether or not for your research project, whether you require ethics to submit an ethics application, and is that just to Imperial or is that also in your local context? We then move on to thinking about funding and grant applications. So what is the funding landscape like in public health right now? What's involved in a grant application? What do grant reviewers really look for? And then finally, we think about public involvement. So why should you involve the public in your research? At what stages of your research can you involve the public? And at what different strategies may you implement to do so? So by the end of Research Portfolio 3, if applicable, you will have submitted your ethics application and should have hopefully received approval ready for Research Portfolio 4, Research in Practice. And within this term, you won't be taking any other specializations. And this is just to give you time and space to really just focus on your own research project, because this is where you'll actually be conducting your project. So if applicable, you'll be going out into the field to collect data, but everyone will be conducting data analysis and data dissemination. And throughout this term, there will be regular drop-in clinics or workshops related to the different types of methodology and projects that the students might be undertaking. And our main summative assessment for the Research Portfolio 4 is a 3,500 word journal article. And we've chosen this is because we really want to kind of encourage students to think about publishing their work. So by having you write a journal article, this is one step closer to you publishing. And then finally, before I finish, I just want to give you some idea of what you can expect from us, the teaching team, and also the material on Coursera while you undertake the research portfolio. So throughout the specializations, there'll be regular live sessions where you can interact with us and each other, as well as there'll be guest speakers such as previous students giving their experiences, as well as other members from Imperial providing guidance on different aspects. If you're unable to attend a live session, you can always watch the recording back. There'll be weekly office hours where you can drop in and ask any questions you may have. You can also ask any questions through email. From Research Portfolio 2 onwards, there'll be group supervision. So you will be grouped with a small number of students, and this will be based upon the similarity of the topic for your research project or the methodology you're undertaking. And in terms of the material on Coursera, there's a variety of different materials for you to engage with. So there's a variety of different videos with interesting visuals, there's interviews, there's podcasts, there's lots of readings, there's loads of different activities. So you can see a couple here. Here's a poll and drag the drop. There's also Padlet. There's lots of chances for you to engage with each other on the platform and off the platform. So on the platform, you can engage with each other through peer reviews, discussion, prompts, and you can engage with each other in live sessions. There's also formative quizzes, and these such as multiple choice questions, so you can really test your own understanding as you work through the material at your own pace. And just to reiterate, we really don't expect any prior knowledge or experience of research. We do start from the basics. However, even students who've had prior experience have really enjoyed this course and found it beneficial because they've said they actually haven't had this systematic teaching in research previously. So thank you very much for listening, and please do let us know if you have any questions, and I look forward to hopefully working with some of you in the future. Thank you.
Great, thanks so much, Natasha. Before we move on to the next section, which is a really great section around your questions and hopefully us being able to answer those, I just wanted to ask you, what's been your favorite part about being on the research portfolio team thus far?
Well, I mean, there's so many actually, but what's really great is actually being able to see the engagement between previous students and current students. We've had several previous students come in throughout the specializations, giving their experience on how they developed a research question, how they looked at the literature, any issues they had, any hiccups, because research isn't a smooth process, and it's not a smooth process for anyone. There are highs and lows throughout any research project, including a master's, PhD, whatever it might be. But it's been wonderful to kind of see the engagement between the current GMPA students and the previous students, because it helps to kind of have someone at a similar level to you to kind of say, yes, I experienced the exact same thing. I went through this and this is what I did, and I talked to my supervisor and this is what I did. And it's been really wonderful. And it's also been really wonderful to engage with the students to hear what are they doing currently, how they're kind of building their research project into their current work, because several students are doing a project based on work they're already doing on the ground or data they already have. So it's been really fascinating to kind of hear that throughout.
Thanks, Natasha. I think that's really wonderful. And you've hit on a couple of points that are so important to us, I think, here at Imperial. And one of those is around mutual learning and really trying to build that community as well. As Natasha mentioned, we have previous students who have graduated from our on-campus programs come in. And now I think our current GMPH students are also speaking with the newest cohort. So, you know, it really goes to show that there is a community, even if you might be from afar, building here, and that's one of the really big benefits that you get out of joining the Imperial team. And I think, as Natasha mentioned as well, this is an opportunity in research, but also in other courses where you can speak with folks who are in the profession, who are doing these things, where you've got, you know, a research supervisor that might be doing some really interesting COVID-related project or something on malaria here in the school. And so I think it really just highlights the opportunities that you get for studying here.
I just saw there was a question about meta-analysis, and yes, there is a course on meta-analysis, and you can absolutely do that for your research project. So the main different methodologies we kind of talk about is systematic reviews or even scoping reviews, and that might include meta-analysis or even narrative synthesis, qual or quant or mixed, whatever it might be. We talk about sort of qualitative, quantitative, including sort of secondary data analysis. Obviously, you might be interested in doing primary data collection, but it's important to kind of think about the feasibility of that. So a mantra you might hear from us in terms of your research question is to make sure it's clear, focused, but importantly feasible, because the term the final term, Research Portfolio 4, is really only approximately 3 months. So that's how long you have to actually complete your research. So it's really important to make sure whatever research project you do is feasible to complete within that time. So we're not saying you shouldn't do primary data collection. Some people definitely are, but it might be more geared towards a qualitative project rather than a big quantitative project. But this is something we can absolutely discuss, and it might be that you already have something on the ground ready to go. So it really is a case-by-case basis, but absolutely meta-analysis is involved.
Thanks so much, Natasha. And I think just to hit on a couple of the research points before we, or questions that are outstanding at the moment before we hop onto some of the other topics. Some of the examples that we have for students that have done projects, someone is going to look at breastfeeding and the amounts of milk a mother produces with preterm children and how different interventions might affect that. We've got some other students that are looking into questions around how you can think about the outcomes of folks in various areas in the US using census tract data and deprivation. So i.e. how does your background, socioeconomic backgrounds, cultural backgrounds, all of that affect your potential outcomes during this global pandemic? I'm trying to think, are there another couple that you can think of? There's some mental health projects. So one of our students is doing a project where it's called Scoping Review, which is really looking into the literature around migration and mental health, or migrant workers and mental health in the Gulf states, which we know that there's not a lot of data in that area in particular, but there is data worldwide. So pulling that together, think about how do you connect the Gulf states with the data that's out there on mental health for migrant workers in other contexts.
There's quite a few projects. I'm supervising a couple of projects looking at obesity. One's looking at how people kind of perceive their health and whether that affects, if they're obese, how does that link between perceived health and weight? And then another one of my students is doing a systematic review looking at the impact of brief motivational interventions for children, obese children, and their experiences, including their carers and sort of health professionals, their views on that. So there's quite a few systematic reviews, but there's also quite a few qualitative and secondary data analysis projects being undertaken. So it really is, there's a huge variety. So please don't think we are going to put you in any box. It's really, think about what you find passionate, and then it's really just about finding the gap in the literature and making sure you have that kind of feasible project within that. But we do give you space in that first specialization, Research Portfolio 1, to give you time to kind of think through this and find the right research question for you.
Great, thanks so much, Natasha. So I am having a bit of technical issues at the moment, and my question and answer box is a bit frozen, but I do know that there are a couple of questions around the certificate and the difference between the on-campus and online programs. So I wanted to just take an opportunity and take a step back and give you a bit of an overview of the programs that we run here at Imperial College. So within the School of Public Health, there are a number of different programs that are run. We have an MSc in Epidemiology and biostatistics. We have an MSc in Health Data Analytics. And those are a little bit different to what we run here, in particular focusing more on the science side of things, or on the stats side. We also run an on-campus Master's in Public Health course, which is quite similar to the course we run, but that course is only a year, so ours is spread over 2. There are a number of differences between that course. Obviously, that's an on-campus course, and so it's been designed specifically to address kind of what you would want pedagogically on an on-campus classroom. On the online course, however, we've redesigned all of our information, all of the learning that you'll get, and it's been designed for an online space. There are a couple of major differences with that as well. So ours is a part-time program, whereas the on-campus is full-time. That would mean that you would come and study with us on campus for an entire year. For us, you study with us at a minimum of 2 years online. Obviously, that's a bit different this year, and we'll have to see what next year brings, but that's the general differences. We do offer some differences in electives, and so if that's something you're interested in, you might want to look at that. I think in terms of who we tend to get on our courses, sometimes there are a few differences, but that doesn't mean that actually, there's any reason not to apply for one over the other. It's really dependent on your own circumstances and your own preferences. And so I think I would say just really think about what you want out of your program. Know that you get the same high quality education in either case. In terms of the certificate that you get at the end, it's the same certificate. It is Global Masters in Public Health versus a Masters in Public Health, but both of them are Masters in Public Health degrees. That's the only difference that you'll see. With the PG certification and the PG diploma, if you wanted to go those routes as well, that is the exact same. It does not say that it's online anywhere. And just to kind of say as well, we really take online learning very seriously. As you could see with what Natasha was saying, we've really designed these courses to ensure that you learn everything that you need to be a public health professional. And so we don't think that the quality is any less because it's online. And actually, we think in some ways maybe it's easier for folks in different situations to be studying with us based on their own specific needs and doing the online course. Cool. So Anna, could you maybe let me know what other questions that you want us to answer, since my screen is unfortunately frozen?
Sure. Another question is about accreditation. Is the program accredited? Why not? And does it have any influence on applying for PhD if it's not accredited?
Yeah, that's a really good question. And this is quite a complicated one, so I won't bore you with all the details. But essentially, accreditation is determined by the state or region in which you're in. It's a very specific process, and it is not something that is necessary for an institution to buy into, essentially. So at Imperial, what we've decided to do for a wide number of reasons is to not accredit our program. That does not mean that actually it won't be accepted anywhere. It is still a fully fledged degree. The primary reason we decided not to do that is really to allow more innovative learning and more global learning. So we aren't forced to teach very specific items. Typically, when we look at accreditation, in particular in the UK, which is different than in other countries, what we see is it's really more focused on specific skills, maybe like clinical skills, for instance, or skills that you might need to be an engineer or a surveyor, rather than more kind of multidisciplinary programs. So that's the route that we've taken. If you do graduate from our program, whether it be with a PG cert or a master's, you're able to take that to any employer. It'll be highly recognized, and you'll be able to apply to any academic program after ours, if that's the route that you so choose. And are there any other questions?
Yes, the next question is, does the 2-year master program offer a good preparation in epidemiology and study design? I'm changing career towards health economics, outcomes research.
Sorry, can you say I missed the very first part, epidemiology and something else?
Study design.
Yes, okay, that's a really good question. So both our biostatistics, our statistics and epidemiology classes do talk about study design, epidemiology focusing much more on that, obviously, as that's one of the core concepts in epidemiology. And so you'll learn the foundations for the quantitative methods that you might use as you might engage in research. As Natasha mentioned, then when you come into the research portfolio, we take a step back and we really start from the beginning and think about the research process there. When you get to the research methods course, you'll go into much more depth around some of the areas that you might need to focus on if you wanted to do epidemiological research, including how you might pick the type of study, which is covered previously in other courses, but really goes into more depth when you look at a specific project for the course for research methods. I don't know, Natasha, if you wanted to add anything to that as well.
No, I think that nicely covers it. We definitely do look at the different study designs, as mentioned, particularly within Research Portfolio 2, the study designs within quant qual and mixed methods, and it's unlikely due to the feasibility that you'd be conducting a mixed methods research for your actual project, but you could definitely either be studying a quant or qual. And interestingly enough, we've had some students come in and say, I'm definitely going to do a quant project. I'm definitely going to do a quant project. And then they take research portfolio 2 and think, I'm changing to do a qual project, and they're actually doing a qualitative project right now. So and just to let you know, your research question that you develop at the end of research portfolio 1, if for some reason you need to change that or adapt it slightly, there is that freedom. So please don't feel like you have to answer that question. You know, if something comes up and you need to slightly change it or move topics, you really will be able to do that and have that freedom. So they came in with a quant research question and ended up adapting it to a qualitative research question. So there is that freedom. Because you have these 4 different specializations, there is that freedom to kind of make a few slight changes over the time.
Thanks, Natasha. And I think you hit on a really good point there as well. So as you saw in the slide around the personal statement, we do want to have an indication of the research question that you want to do when you do apply for this program with us. But we don't need you to have a full-fledged research proposal. It's really just a short paragraph about what you think you might be interested in. I might be interested in mental health. I think I don't know what I'm interested in. And in fact, the reason why I want to join this course is so I can learn more about research. And that's absolutely fine. It's just a preliminary kind of indication, and I wouldn't spend more than about a paragraph of your personal statement on that. It's just really to get us to understand and know you a little bit better, and for you to think about whether or not this program is right for you as well, because it is such a big component. It's a third of your entire degree, so we want you to just get thinking early about your experience in research and what you want to get out of this. Anna, are there any other questions?
Yes, so there is a question about the student profile. Was there any particular number of years of experience, any background they come from? So, for example, is the program suitable for pharmaceutical degrees, for medical degrees? That's a bunch of questions in one.
Yeah, it's a great question. And it's one that I don't have a great answer to, in the sense that public health is very multidisciplinary. And that means that when you come in, you can come from a wide variety of backgrounds. When you study and you go into public health afterwards, you can come from a wide variety of backgrounds as well. You've got you've got in water and sanitation, you've got engineers, as well as folks who've studied microbiology, for instance. So what we say is that there is no one profile that is right for us. We do have a mix of students from clinical backgrounds, from undergraduates in social science or hard sciences. We also have folks that have been working for quite a while, either in the field of public health or in another field entirely and want to switch. That's all absolutely fine. What we ask you to do is just tell us why it is that you want this program. That's, again, how we kind of make and look at these decisions. When we do review your applications, we do keep an eye out on your backgrounds, but only as, again, that relates as well to your personal statement. So what we typically do see is that our group of students are a little bit older and have about 5 years of experience sort of under their belts. Now, that does not mean you can't apply straight out of undergraduate, but it might mean that our students are a little bit of a different profile because it's fully online. Again, we're a new program, so that's ever changing, but I wouldn't say that any of these should put you off from applying. Natasha, I don't know if you want to add anything from your experience as a reviewer either.
No, I think you covered that nicely, but just to iterate, I saw a question. I saw a couple of questions about saying that your background might not be currently in public health. So really want to encourage, we've had multiple students coming in from finance, pharmacy, health related, but not necessarily public health, such a wide variety. And if you are currently not working in public health, that's not a reason not to apply. We are interested, we look at a variety when we review, look at a variety of aspects. And really, we're also interested in sort of your interest in public health. Why are you interested in public health? Why do you want to do this course? You may not be working in public health, but you might be, you might have gained some volunteer experience in public health. You know, you might be doing some volunteer research in public health that, you know, you may not. It's okay if your background isn't currently in public health. So please don't think I can't apply because I don't have that job in public health currently, or I haven't trained in public health previously. No, that please do think about applying. We look at a variety of aspects, but the main thing was we really want you to tell us why you're interested in doing this course.
Absolutely. Thanks, Natasha. I think that also kind of connects us actually to another question that often comes up is what does a career in public health look like? So you may be thinking about, do you want to do this PG Cert, DIP, or the master's? And I think what I would say to that is that in terms of what you come out with, they're very different offerings. And what I would suggest is think about the jobs that you might want to have afterwards. Have a look at the requirements on those jobs and see sort of what that gets you. The PG certification or diploma are ideally seen as more kind of professional qualifications, where often an MPH is academic, but I think there's value in all of them, and it really just is what you think you need. That being a bit beside the point, what kind of a career can you get in public health? And what we say is that our students and our faculty come from a really wide variety of backgrounds. They come from a more purely or traditional academic background to a more field-based background. I myself spent about 8 years in sub-Saharan Africa before I came to teaching, and I was mainly designing and running programs and research projects. And I always had a love for teaching, and I was really lucky to get a job starting to teach and building curriculum. So I used, again, my training experience from on the ground, really thinking about what do you need as a public health professional, and brought that to our course. And I know, Natasha, your experience is quite different, but we've got students that go and work for places like the UN. We've got students that go into policy. The world is really your oyster, and I know that doesn't really help. But again, I would think about sort of what you've seen in this pandemic. Think about who has been engaged in this work and who maybe is missing. If it's international health that you want to do, go ahead and look at what some of the NGOs do. Go and look at what the WHO does. You know, basically, you can do anything with this degree. Maybe, Natasha, do you want to tell us about your background and what brought you into public health?
Yeah, I mean, I actually started in psychology, so I've always been really interested in mental health, and so I did an undergrad and a master's sort of in psychology, and then I went into research, and I sort of just fell into global health research, but more specifically HIV research. And then I did my PhD looking at barriers to antiretroviral adherence for people living with HIV in Zimbabwe. And then I've been doing a bit of teaching here and there, and then I applied, and I've really enjoyed kind of going on and focusing more on teaching, but my background's more in research, and this is kind of my first sort of full teaching role. But there are so many different routes, and there are so many different jobs in public health. I think the one thing the pandemic, as Kat said, has shown us is how many people are involved and are working in public health. And I think the pandemic has really highlighted to us how important public health really is. So if there's any time to learn about public health, it's now.
Indeed.
To get involved.
Absolutely. I heard this one really interesting kind of commentary on public health is that often we're in the background doing, working away on all sorts of things around surveillance, around social equity, around policy, and that you don't know that we exist until we hit the crisis point. And I think in many ways that's what this pandemic's shown. So I suppose it also just shows how important this field of study is. And how exciting it can be. Hopefully we aren't in a position where, where we are like now with the pandemic in the future, but, if nothing else, it's shown us that we can really address the situation, and you can call in the scientists and the policymakers and all sorts to really help bolster a global-wide effort. Are there any outstanding questions, Anna, before we wrap up?
One moment. So there are questions whether the degree helps to work for WHO or for RWE.
Yeah, I mean, I think it does. So this degree really puts you, whether you're early in your career and you need some experience to add to your CV, or whether you're switching careers or are late in your career, this absolutely does help to get to those jobs that you are most interested in. WHO being one of them, but various NGOs, government entities, being others. I know that we've got lots of graduates that work here at local governments in the Department of Public Health as well. So yeah, I think absolutely these are all very possible and really great opportunities for folks as they move forward.
There is another question on since this is an online degree, how do students do the research?
That is a good question. So you do it just like everything else online. However, obviously, as Natasha said, you've got lots of opportunity to speak with us as the team that teaches, but also your program support teams. What we do say is that often, as Natasha's mentioned, these are areas of interest that you might have. So you might be working closely with someone at a home institution that you have connections with, whether you work at a hospital or whether you're connected. We've got one of our students who's connected with an NGO and is now doing a project with them, which is fantastic. What it means is that you do your work kind of offline with us. But that doesn't mean that you can't access databases, or it doesn't mean that you can't do your own data collection in a live setting. So much like if you were studying in London and you wanted to do a project in Uganda, let's say with an organization that you have a connection with, sometimes you might do that here in London and use the internet as the medium to do that. But sometimes you might fly to Uganda and do that project there. So those, so nothing really changes in that way. It's just that we often aren't in a room together and instead are on Zoom or various other methods of speaking to one another. But nothing really changes, and we really work with you to try and figure out how to make your project work in the context in which you're in or the area that you're most interested in.
Yeah, and I've seen a few questions about whether or not people can research on particular topics, and all we ask is that your research question is related in some way to public health, but that is quite broad in itself. So we have, as we mentioned, a variety of different topics that students are undertaking. So if there's a particular topic you're interested in, it's really about then kind of searching the literature, which you don't have to do now. You'll take that as part of the research project, then searching the literature, finding that gap, developing your research question. But as long as it's related and you can explain how it's related to public health, we're very happy for you to undertake a research project in that topic. So it's really kind of open, and we've really left it up to you to kind of find the areas you're passionate about, you're interested in. What do you want to do after the masters? It's really just about delving into your own interests, and then there's lots of places to kind of support. So within the first specialization, Research Portfolio 1, we have these drop-ins online via Zoom, so you can talk with members of the teaching team about your research question. Do you think this is good? What do you think about this? And sort of have these discussions. So please don't feel like you won't have someone to talk to or bounce ideas off. As I mentioned, from Research Portfolio 2 onwards, there'll be group supervision. So it won't just be the Research Portfolio team or your supervisor. It'll be a group of peers that you can bounce ideas off and have this discussion and support each other. So we may be not in the same room, but there is that same level of support.
Absolutely. Thanks, Natasha. So we're drawing to a close. So I want to just take an opportunity to bring us back together. If your specific question wasn't answered, what we will do after this is we'll collate a list of the commonly asked questions. We'll put that together and send that around to the group. We'll also be sending out the recording in case you want to go back and look at these things. If you do have any queries you can write that weren't specifically answered, you can write to GMPHqueries at imperial.ac.uk. to ask those queries about your specific situation. Just to review kind of where we're at, we do have a number of different programs that you might want to explore further. What we would strongly suggest is to please go to our Imperial web pages to see the course offering itself. You can also find information on Coursera about our course. We have, as we are really focused on global health equity, as you can imagine, as a global health program, we do have open courses as well. You're able to either get a certificate in those or also to do those to test them out for free to see if you might want to engage with our own course and see if this is the right course for you. Often we get folks that say, oh, I'm really nervous about statistics. This is an opportunity. Go in, see if you think Professor Bottle is someone that you can learn statistics from. Actually, we find that almost everyone is really excited that he's really easy to learn statistics from. So just to kind of ease your fears, or if you want to get a taster of what it might be like to learn with us. Obviously, we add a lot more value when you come and join us as a PG Cert or as a master's student to those open degree courses where you study on your own. We really encourage you to look at those. And then again, if you've got a specific situation based on the outbreak, please do look at the COVID-19 pages. They really do help support students in those situations. Finally, the last thing is I would encourage you to apply early and to think about the documents that you need to pull together as you do that application process. We do review our applications on a rolling basis and do have a limited number of spots in our program. So we do encourage you to really think about if you want to apply and apply right away if that is something that you'd like to do. And with that, I think I'll close it up. Thank you so much, Anna and Natasha, for joining us today, presenting and answering questions. And thank you all from all over the world for joining us as well to listen to our spiel about our program. We hope to see your application. And if you're accepted, we hope that you join us in the fall. Thanks very much.
Great, thanks everyone, bye.